what was it like working in the hospital setting? So for you who don't know, I did my first 5 years in the emergency department. I was a brand new grad. I was a baby nurse going into that ER, and I would describe it as a roller coaster because you have your ups and your downs and your side to sides. You are constantly being pulled in different directions in that emergency room. And it goes for med-surg as well. I don't have experience in med-surg, but I hear things. Both places are pretty busy, but in the emergency department, you're constantly getting new patients in, and then all of a sudden they're out, and constantly coming in. So you have this list going on in the back of your mind of, what do I do next? What's next? Oh no, like I need to now prioritize and switch things because, even though I have someone who's vomiting over here and I want to get Zofran to them, which is the medication to make them stop vomiting, and I know they're uncomfortable, but I just had a chest pain patient walk in and they don't look good, but I already have the Zofran in my hand for this vomiter. What do? I need to go to that chest pain person first and make sure they're not having a heart attack before going over and giving this poor person who's vomiting everywhere, and I feel so bad for them and I want to get them Zofran. So you're constantly prioritizing as patients are coming in. And I liked it though, because it would keep you busy. It would make the day just fly by. Of course, there are those days where it just feels like it drags on forever because you have a bunch of difficult patients who happen to come through the door. But I actually loved that. I loved having those patients pop in and pop out because I guess it gave me a feeling of like accomplishing something. A lot of people come into the ER because they have a problem. A lot of times we can fix it and then we can send them out. Or we can make it feel better and then we admit them upstairs. So it was nice. I liked that faster pace environment. But I'll also say when I was young and didn't have any kids and wasn't married, I only had to worry about me. I really did like those 12-hour shifts because I would work a chunk of shifts and then I would have a large chunk of time off. And I could essentially switch days around occasionally and have a huge amount of days off and take a vacation without actually using PTO, without using my time off. So that was kind of a nice perk in the hospital setting that I don't see in the outpatient setting right now. And if I were to ask myself, like, would I ever go back to working in the ER? I wouldn't say absolutely not. I would say probably not, because now that I am married and I have a family and I have kids and I want to do after school activities with them, working that 12-hour shift is just a little more difficult. And I do appreciate being in the outpatient world where I have a very regular set schedule, which is, 8 hours a day. So going back to that question of what it's like working in a hospital setting, I describe it as a roller coaster. You're kind of all over the place, but it was a lot of fun. And yeah.